These are the cells called the microglial cells that are taking the front of the stage now, because when they go south, it sets the stage for every type of brain degenerative condition that you could think of. When our blood sugar is elevated, when we become insulin resistant, when there are higher levels of inflammation in the body, these polarize our microglia away from being brain defending, away from being supportive to their threatening M1 configuration. What we're offering are the keys to the kingdom. Get your metabolic house in order, and you will be going a long way to preserving brain function. It's that simple. The Lancet back in 2024 listed 14 lifestyle factors. If they could be brought under control, the rates of dementia in the Western world would decline by 50%. What's happening, however, is the rates of dementia are exploding, expected to triple by the year 2050, not because we are aging, not because there's been a genetic change. So it's something environmental, like our food and our lifestyles, that are threatening the brain. You're wondering, what is it? Is it food? Is it exercise? Is it sleep? Is it socialization? The number one thing that you can do to set yourself up for brain health is to
do me a quick favor, check and see if you're subscribed to the show. If not, hit that subscribe button. It's a simple and free way to help me out. And for you, you're going to be more likely to see future episodes on YouTube, and you're going to join the growing community. It's a win-win all around. Thank you so much. I appreciate you. Let's get into the show. Dr. Perlmutter, what are microglia, and why haven't they gotten the respect they deserve?
Microglia, and that's a very important name for people to remember, are the components of what's called the brain's innate immune system. And what that means is really quite interesting, because the whole notion that the brain had its own immune system is a very new idea. It was thought for years that, well, if there's an infection or something in the brain, that immune cells would come from the rest of the body, work their way through the blood-brain barrier, and deal with the infection. And to some degree, that's true. But we now recognize that these microglial cells live there, and they represent immunity in the brain. They've been seen for years and years, and they were thought, when you looked at them just on a slide under the microscope, you'd see these cells connecting neurons, and you thought, well, they're the glue. And that's where the term glia comes from. Microglia means glue. And it was thought that these were just structural components holding the brain neurons together. But the reality is they're always moving around, looking for things, looking for something to tidy up. So they are the immune system of the brain, but they do a lot more than that. And that's really what's so exciting is, beyond just being on guard for infection, they're actually, when they are happy, and that's really, I think, the central part of what you and I are going to talk about today, what we call M2, they're doing much more than just dealing with infection or waiting for something to happen. They're nurturing the brain cells. They're keeping the blood-brain barrier intact, and they're actually fostering the formation and stability of synapses, which is where one brain cell connects to another, which is really fundamental as it relates to learning. So these are the cells called the microglial cells that are taking the front of the stage now. They're in the spotlight, because when they go south, when they become dysfunctional, it sets the stage for every type of brain degenerative condition that you could think of.
Okay, well, let's talk about the two different phenotypes, M2, M1. Best we can, we want them in the M2 state. Let's talk about why they would switch and what inputs cause that.
Very good question. And this shift in the brain's immune cells away from being friend to being foe, shifting from M2 supportive to being M1 destructive, to be fair, that's a construct that neuroscientists have created for simply understanding this shift. There are a multitude of different phenotypes between M2 and M1. In other words, it goes through a lot of different iterations until it's fully a full-on M1 destructive. But unfortunately, one of the main issues that forces our supportive M2 microglia to becoming M1 is age. And, people would say, well, you can't do anything about that. You can't reduce the number of birthdays that you have. But here's where the story gets really interesting. because it's not our chronological age, in other words, the number of times that we've gone around the sun, it's our biological age. It's the marker of how youthful or aged our bodies are, and we can now test that with some very interesting blood work called methylation clocks. So this is a determinant in terms of, do you shift from M2 supportive to M1 destructive? But really important, because these are levers that we can pull. One of the major drivers that we can control, actually there are two really important ones, and we'll talk about them. Number one is inflammation anywhere in the body that makes its way to the brain. And number two are metabolic changes, like increases in our blood sugar and our blood pressure, loss of insulin functionality. Things over which we have great control can help us keep our M2 microglia doing their job, our microglia in their brain defenders kind of phenotype, as opposed to nudging them towards becoming the evil twin. And let's be clear, this shift of the microglia from supportive to destructive is now looked upon as representing the central feature in all neurodegenerative conditions, including the biggies like Alzheimer's and Parkinson's and frontotemporal dementia and progressive supranuclear palsy, multiple sclerosis. We could go on and on. But isn't it incredible that these diseases are now looked upon for their similarities as opposed to their uniqueness, their differences? So it really allows us to vociferate lifestyle changes that reduce inflammation and bring us back to our metabolic health as being important inroads to overall brain health and reducing our risk for having our microglia shift to being destructive, paving the way for brain degeneration.
Okay, in a general sense, M2 is where we want to be. But in a normal, healthy brain, what would that ratio of M1, M2 be?
Difficult to say. It's, as I mentioned, very, very age dependent. It can change from 1 to 1 to 1 to 2 and 1 to 8. In other words, a much more likelihood of M1 phenotype destructive microglial cells as we age, and certainly as we become metabolically compromised. Pretty much you can't slow the hands of time. Though I mentioned biological aging is certainly, more important than chronological aging, but we sure as heck can bring our metabolic health back into where it needs to be, in terms of reining in our blood sugar, re-establishing insulin functionality, reducing inflammation. So, that's a key player here, that the chemical mediators of inflammation that we call inflammatory cytokines can be produced anywhere in the body, including, for example, the gut. When the gut has issues with the gut bacteria, the microbiome, and becomes leaky, then these chemicals are produced in the body, these inflammatory cytokines that go by fancy names like interleukin-1 beta and tumor necrosis factor alpha, for those who want to take the quiz when you and I are done today. But anyhow, they make their way to the brain, and they force these supportive brain defenders, the M2 microglia, into being destructive. This is well before we get these accumulations of things like beta amyloid. It's been thought until quite recently, as in within a few months ago, that the cause of Alzheimer's disease was beta amyloid. That's what the notion has been for several decades, to the extent that, the FDA approved drugs to lower beta amyloid as a treatment for Alzheimer's disease. The drugs do not work. This was finally codified, if you will, by what is called a Cochrane analysis. This is a large-scale study that basically looked at all of the well-conducted scientific research at evaluating the effectiveness of these beta amyloid FDA-approved drugs for the treatment of Alzheimer's. This study was just published, a review of 17 publications comprising 20,345 patients, and it found that the utility of these drugs was, in their words, trivial, and there was a significant threat to using them. So we now understand that well before and well beyond beta amyloid accumulation in the brain, are these changes in the brain's microglial cells that we've been discussing that really presage not only the accumulation of beta amyloid, but the cognitive decline that defines this illness.
To riff off of what you just said there, this recent Cochrane review, these drugs, as you mentioned, didn't have a meaningful effect on things for people with Alzheimer's, but also, you touched on this, there was negative side effects.
That's right. And, to be fair, doing the right thing in terms of treating a patient is to look at what is called the risk-benefit ratio. In other words, you look at the risks and you look at what is the upside. Here, there's no upside, and the risks are significant. About 23 to as many as 28% of patients receiving these drugs experience what is called ARIA, A-R-I-A. It's an acronym that means amyloid-related imaging abnormalities. What does that mean? It means that patients on the drug, 28%, are going to have changes in their MRI scans when they are followed, as they should be, which includes edema, which is swelling in the brain, and also hemorrhages in the brain. In 28, more than a quarter of these patients get these things, the long-term consequences of which are not known, but I don't think can be good. Hemorrhaging in the brain and swelling, I can't imagine that's good for the brain. And even the name, amyloid-related imaging abnormalities. No, it's not amyloid-related. If it were amyloid-related, we would have seen these abnormalities on patients prior to treatment. So to be fair, it's treatment-related imaging abnormalities. And the other thing is the drugs were originally developed and petitioned the FDA to modify Alzheimer's disease, the cognitive decline. It was found that the drugs had no effect on cognitive decline of any meaning. So then the creative manufacturer said, well, okay, we're losing that battle. What else can we do? Oh, let's see if the FDA will approve our drugs for removing beta amyloid from the brain, because as we all know, that's the cause of Alzheimer's. It isn't. But anyway, they were quite successful in showing that their drugs removed beta amyloid from the brain, and the FDA gave them approval then. But that doesn't help patients in terms of their clinical course. That's the bottom line here. Not a biological change of ridding the brain of beta amyloid. That's not the issue. That's not our goal. Our goal is to slow the cognitive decline. That's one goal. Arrest the cognitive decline. That's a better goal. Or improve cognitive function would be the home run we are all looking for. And as we recognize that these microglial cells, the brain's immune system, the first question you asked me today, are really upstream of all of this, the cognitive decline, the loss of synapses, the accumulation of beta amyloid. Whatever we can do to keep those microglia intact and in their brain-defending role and nudge them back to being this M2 configuration when they've become brain-threatening is really got to be the goal. And it's incredible to see how much research is now being dedicated using this as a platform.
As a neurologist, somebody that's been focused on the brain for your whole career, when did you first get turned on to microglia?
Relatively recently. And I would say probably about in the last 8 years. I do my best to stay as tight to being on top of the literature as I can. And that's about when, the world was suddenly made aware that, hey, these are the cells that are involved in brain degeneration, really of any kind. So this is relatively new information. But for me, the exciting thing is it really sews together so much of what I've been interested in for an awful long time. Many years ago, I wrote a book called Grain Brain, which focused on how refined carbohydrates and a diet that favors refined carbohydrates and sugar, which is refined carbohydrate, of course, threatens the brain and sets the stage for increasing Alzheimer's risk. And thereafter, I wrote a book called Brain Maker, and Brain Maker looked at what is the connection between changes in the gut microbiome, of all things, and risk for the brain. That was, quite a while ago as well. I then wrote a book called Brain Wash that dealt with how these changes affect how we see the world. And thereafter, another book called Drop Acid that focused on the role of uric acid in the body and how elevated uric acid changes our metabolism and can be threatening to the brain. So the exciting part about the new work that answers your question about the microglia is that it brings together in one understanding everything I've been looking at for decades. Why is it that patients with type 2 diabetes are at higher risk for Alzheimer's disease? Why is it that if you're a type 2 diabetic, you have a 60% increased risk for becoming a Parkinson's patient? What are the relationships between these metabolic issues and brain health? What about gluten? What about a high-carb diet? What about changes in the microbiome? Things I've been deeply involved in exploring for a number of years. They're all explained when you look through the lens of the microglia, the brain's immune system. Everything influences the microglia, friend or foe, supportive or destructive. So in a very real sense and an empowering sense and an encouraging sense, this new understanding brings together everything I've been interested in for 40 years.
Is there anything specifically that's changed, either diagnosis-wise or treatment-wise, given this new upstream information?
Well, diagnostically, I think that we are now able to appreciate the idea that our metabolic markers are things like our fasting blood sugar, our fasting insulin level, our hemoglobin A1C, blood pressure, of course, lipids, of course, triglycerides. Other markers that look at inflammation, for example, like highly sensitive C-reactive protein, fibrinogen, sedimentation rate, that these are surrogate markers for increased risk for brain degeneration. Why? Because when our blood sugar is elevated, when we become insulin resistant, when there are higher levels of inflammation in the body, these polarize our microglia away from being brain defending, away from being supportive to their threatening M1 configuration. So it really allows us now to connect these important dots such that we can look at an individual's metabolic blood work, which is nothing really exotic, and say, well, it looks as if you're pre-diabetic or you're full-on type 2 diabetic, or that your fasting insulin level is a little higher than it should be, meaning you're at risk for prediabetes and therefore full-on type 2 diabetes at some point. Or your BMI is elevated, or your waist to hip ratio, a better marker of fat deposition, is elevated, or inflammatory markers are elevated, or you've got bowel issues, or even other lifestyle issues that are not typically seen in a laboratory evaluation, like quantity and quality of your sleep. How much exercise are you actually getting, and what type of exercise is that? What are your socialization habits? Do you spend time outdoors? What is the quality of the air that you are breathing? All of these things we've known are important issues, and when they're not where they need to be, are risk factors for brain degeneration. We now know that they all influence the microglial cell. So very, very important. That said, clearly there are more sophisticated markers that we can begin looking at. Things, for example, like p-tau 217, phosphorylated tau protein P17, has become a very sensitive and fairly specific marker of where a person might be in terms of Alzheimer's risk, or if they are an early Alzheimer's patient or a mild cognitive impairment patient, where are they on that scale? So there's a lot of excitement that, interestingly, for me, plays into looking at the world through the lens of the microglia as it relates to brain health.
So by the sounds of it, we can use these other proxies, looking at metabolic health, looking at inflammation, to get an idea of the phenotype of our M1 and M2. Is there a specific test we can look at that? And if there is it something we should bother with, or should we just look at these other proxies to get a good idea?
I think the proxies give you a terrific sense as to what's going on with the polarization or lack thereof of your microglia away from being supportive. From a research perspective, we embrace the idea that we can tag the M1 microglia now using a binding agent called TSPO that binds to a specific receptor on the threatening microglial cell and allows us, using that binder with a PET scan, to image the brain of a living human being. Again, only in the research setting. And this lights up, this TSPO imaging lights up and is seen to light up in Alzheimer's and Parkinson's, in all the major neurodegenerative conditions, and also in things like PTSD, major depression, and even long COVID. So what does that tell you? It tells us that, these are issues in which the microglia have been changed away from being supportive to being in their destructive mode. And once they become destructive, M1, that can be brought on by the fact that there's inflammation causing this, like having had a COVID infection or inflammatory bowel disease, which seem, very, very much disparate, but in reality, both are highly inflammatory. The problem becomes if we recognize that inflammation is a key player in changing those brain immune cells from being supportive to being threatening, recognize once they adopt the M1 phenotype and become threatening, then they are increasing the production of these inflammatory chemicals in the brain. We call it neuroinflammation. Now we have even more inflammation that is further polarizing those microglial cells away from being supportive. This becomes what we call a feed-forward process. So yes, the football player who no longer is playing football but has been diagnosed with CTE, chronic traumatic encephalopathy, worsens over time, even though the inciting agent, the head trauma, is no longer happening. It's why Muhammad Ali got worse with respect to his pugilistic Parkinson's. Pugilistic means basically a boxer, repeated blows to the head. So he's getting worse with time, but he's no longer in the ring. This is an explanation now to our long query as to why do these issues continue to worsen with time? Why does Alzheimer's continue to worsen with time? It's because this spreads through the brain like a cancer. And there are many similarities in terms of the spread of the change of the microglial cells to cancer, because there's also a change in the metabolism of these cells away from kind of healthy mitochondria producing energy to a different type of energy production called glycolysis, which is exactly what happens in cancer cells, the Warburg effect.
So by the sounds of it here, this being so upstream, the changes to the microglia and the different diagnoses, whether it be Parkinson's, traumatic brain injury, Alzheimer's, how do you look at the symptoms and the diagnoses? Is that just a genetic thing? Once the microglia transform into the M1, how for different people does that look different?
That's a home run question. And I have to tell you, I have pondered that question. I have ChatGPT'd that question. I have researched every publication that tries to make sense of that. And I have not really yet stumbled upon an answer. We know that there are multiple inroads, and you mentioned a couple. Well, at least you mentioned one, genetics. We know that genetics certainly plays a role. But I think more importantly, epigenetics plays a role. I think that new research, one researcher name comes to mind, Dr. Sarah Marzi at the Marzi Brain Institute in the United Kingdom, has demonstrated that not so much genetic changes, but epigenetic changes that are seen in different parts of the brain. In other words, the controlling mechanisms over our gene expression are seen to be different in various parts of the brain. She found significant epigenetic changes in the cells in the part of the brain that makes dopamine as it relates to muscle motor activity, that part of the brain called the substantia nigra that is involved in Parkinson's. So this is exciting new research. Another idea has been that, well, that part of the brain, because we're always really active, is very, very metabolically active and therefore at risk for energy deprivation because it doesn't get as much energy. But it's a home run question, and I wish I had that answer. But I think we're very close to understanding it. I think that Dr. Marzi is pretty much going to come up with it. She seems to be going down the right road in studying the epigenetic differences of various parts of the brain. And I think it's those epigenetic changes that are setting the stage for then the microglial cells to become activated more so in particular areas of the brain, the frontotemporal area in frontotemporal dementia, the basal ganglia and substantia nigra in Parkinson's disease, primarily substantia nigra, and the parieto-temporal regions in Alzheimer's, and the list goes on. But that's a very sophisticated question, and it's interesting that you bring that up.
Hearing you talk about epigenetics, the fact we can go from M1 back to M2, there is hope here, and we're going to get into the things we can do to keep the M2 as best we can. But my question is, somebody that has been in that M1 state predominantly for a long time, how much reversal is possible? And how is it different than somebody being preventative and just keeping the M2s by living a healthy lifestyle?
I think those are not mutually exclusive. I think we want to preserve our M2 microglia, and at the same time, we know we all have some degree of M1 microglia accumulation as well. We want to try to nudge them back. How effective can we be? Significantly effective. And I think that the cognitive stabilization that we see with lifestyle intervention studies, like the study from Dean Ornish and Rudolph Tanzi at Harvard, for example, kind of powerful way that they reduce the rate of cognitive decline in established Alzheimer's patients, I think is explained in part by what likely has happened to these threatening M1 microglia. We've seen in animal work various techniques, like even reestablishing what's called gamma oscillation, a rhythmic pattern in the brain using interventions like a light flashing at 40 hertz. Research by Dr. Li Wei Tsai at Massachusetts Institute of Technology has actually targeted, using her therapy, this 40 hertz light and sound, demonstrated reversing M1 polarization back to M2. And that said, just to really hammer this home, put a pin in it, as they say, there is exciting research now using transplantation of microglial cells in humans, M2 supportive microglial cells, for therapeutic benefit, in a very, very unique disease process right now. But I suspect we're going to see more and more of that. And at the same time, research looking at targeting the receptors on the M2 microglia to keep them in that configuration, and also to help morph those M1 back to M2 as well. Not to be too technical, but there's a receptor on both M2 and M1 microglia that nudges it back to M2 supportive, called the TREM2 receptor. And there's a company called Vigil Neuroscience, VIGIL, recently acquired by Sanofi, that has developed a really exciting way of targeting that receptor, and with the idea of nudging them back to being M2 configuration as a therapeutic way of treating these neurodegenerative conditions. So very, very exciting.
Okay, so we know a couple of the big ways that this is happening in the brain: the M2 going to M1, metabolic dysfunction, inflammation. And since metabolic dysfunction is such a big player in today's modern world, so many people, 9 out of 10, maybe even more, being affected, let's talk about the physiology there. As somebody becomes metabolically unhealthy, the change is happening in the body and then the brain.
That's right. And, as you were asking your question, I was actually teeing up that metric that more than 90% of American adults has at least one component of metabolic syndrome. That's scary. That means only 10% of American adults is metabolically intact. It's worrisome in that, number one, many of these people don't know it. 90% of adults in America who are pre-diabetic have no idea that they are pre-diabetic. But again, meaning that 90% of Americans is metabolically compromised to some degree or another, setting them at risk for brain degeneration. That's really important. And that's why we do what we do, right? It's why we really emphasize that, what we're offering are the keys to the kingdom. Get your metabolic house in order, and you will be going a long way to preserving brain function. It's that simple. I mean, you made it very clear. That's the biggest issue. That's the metabolic compromise. Really, and it's global. The World Health Organization has characterized chronic degenerative conditions as being the number one cause of death on planet Earth. And these chronic degenerative conditions are by and large metabolic, and they're by and large related to our lifestyle choices. So, our lifestyle choices are responsible, basically the number one cause of death on planet Earth, not wars, not other issues. And so it's a very sobering statistic that, there are about 7 million Alzheimer's patients now in America, costing us, about $350 billion a year. And every time I speak that metric, I always correct myself, because that's not the biggest metric of all. The biggest metric of all is the cost in terms of the emotional trauma to loved ones, family members and loved ones. How do you put a price on that? Having been through that with my father dying of this disease, it certainly gave me a different perspective as I treat patients in terms of what they're going through, in terms of what their families are going through. So again, you brought up the biggest issue, and that is our metabolic mayhem that is setting the stage for these microglial cells to shift and lead to brain destruction. That's in a nutshell. So a lot of Brain Defenders, the new book, is dedicated to this understanding that we've got to understand what we can do to measure our metabolic metrics. What does it mean to have a fasting insulin level? What does A1C actually mean? What's going on with respect to A1C? And better than a fasting blood sugar, why would we want to have a continuous glucose monitor? Not all the time, but try it out for a couple of weeks and see what you may be doing that's worsening your blood sugar. These are incredibly important because the seeds are sown for Alzheimer's disease in our 30s and 40s based upon our lifestyle choices. Genetics and Alzheimer's, not really that strongly related. The reality is it's modifiable lifestyle factors. One interesting study appeared in the journal The Lancet back in 2024, and it listed 14 lifestyle factors. If they could be brought under control, the rates of dementia in the Western world would decline by 50%. What's happening, however, is the rates of dementia are exploding, expected to triple by the year 2050. Not because we are aging. That's not the excuse. Not because there's been a genetic change. No, that doesn't happen. It takes about 70,000 years for that to happen. So it's something environmental, i.e. something outside the body, like our food and our lifestyles, that are threatening the brain. You've got to exercise. You've got to get a good night's sleep. You got to get your blood sugar under control, and you got to eat foods that are good for your microbiome. Can you imagine that here we are talking about the role of the gut bacteria in an Alzheimer's conversation? Yes, we are.
Well, I know it's something you've been talking about for years, and you're passionate about that connection. So give us the lay of the land in a general sense. When changes happen in the gut, how that impacts the brain.
Well, gut changes induce permeability or leakiness of the gut wall. When we mess with the gut bacteria and put them out of balance and reduce their diversity, then they can't do what they need to do. And the gut bacteria don't do a whole heck of a lot of things for us, but the things that they do for us are of fundamental importance for our existence. What do? Well, they create various vitamins, B vitamins. They help create our neurotransmitters, allowing the brain to work. And they create chemicals called short-chain fatty acids that do a lot of wonderful things around the body. They go to the brain and influence even how our DNA is expressed in the brain, especially one called butyrate. So we really depend on our gut bacteria to keep us alive. Again, the most fundamental thing that they do, or one of the most fundamental things, is maintaining the integrity of the gut wall. So when we are overdoing our non-steroidal anti-inflammatory drugs like ibuprofen, or taking an acid-blocking drug because we think we need it for our heartburn, or taking antibiotics when we don't need them, or eating a diet that's high in ultra-processed foods and is devoid of dietary fiber, for example, that would otherwise have nurtured our gut bacterial friends who want nothing more than for us to survive, because that's how they survive. Then we set the stage for these issues whereby the gut lining becomes more permeable. So things get from the gut into the rest of the body. And when they go through the gut lining, they stimulate receptors that turn on the production of inflammatory cytokines. These inflammatory cytokines, as mentioned earlier, make their way to the brain and can get through this blood-brain barrier. And guess who's right there adjacent to the blood-brain barrier, waiting to see what the heck's going on in the environment? You guessed it, the microglial cells. First thing you know, they see these inflammatory cytokines. They say there's trouble. We're going to shift into defense mode and shift to the M1 phenotype. That's good in an acute infection. But chronically having that happen, chronically having elevated inflammatory cytokines in our bodies, as is what happens with obesity and diabetes and leaky gut or inflammation from any cause, they shift to becoming brain destructive as opposed to brain defensive, and it sets the stage for bad things to happen to the brain. This is this incredible connection then between what's going on in the gut and what's going on in the brain. I did not know this when I wrote Brainmaker. When I wrote the book, the first book out for public use, consumption, that related the gut to the brain, the gut-brain connection. Didn't know it back then. So this, really supplies that corner piece of the jigsaw puzzle that you've been waiting to put in, that really ties together the two sides. And it's very exciting because, it's great to understand it. And one less thing for me to worry about and be concerned about how it works, but how empowering it is that we now can recognize that when we change people's diets and reestablish gut health, we're going a long way to improving their whole body milieu as it relates to ultimately the brain.
You brought up something really important there when you said cytokines are going through the blood-brain barrier and activating the M1. We've been shitting on M1 throughout the conversation, but they do have a role when it comes to acute.
That's right.
So I'm glad you brought that in, because they're not all bad. It's when we chronically convert the M2 to M1.
So we would expect in the case of head trauma or a stroke or infection that we want our M2 to shift to M1 to do the immune-related kinds of cleanups that they would do. But when the fire is out, the firemen need to leave. We don't need them anymore. They're in the way. And it's that shift back that leads to problems. Let me give you an example. If you look at large data sets of individuals who experience head trauma, there's a much worse outcome in individuals who experience head trauma who also happen to be type 2 diabetic, because they've already shifted a lot of their microglial cells over to being M1 to start off with. And number two, it's far more difficult for them to shift back to being M2 supportive after the trauma event. So they stay in the hospital longer, and their degree of neurologic compromise is worse in comparison to non-diabetics. So, that shows you that, there's a time and a place for us to have M1. I mean, it doesn't happen that way, just so that we can develop these therapies. There's a role for M1, that's for sure. There's a role for M1 macrophages in our periphery. We have the same M2 and M1 kind of dichotomy in the immune cells, some of the immune cells in the rest of our body as well. They shift to M1 when they're needed, and they go back to M2 when they're not. They go back to the firehouse and they do maintenance work on the fire engine, right? That's what they're doing. They go back to M2 in the brain and they're taking care of our neurons, taking care of our synapses, shoring up the blood-brain barrier. But it's this inability of them to shift back to M2 that is the reason that people, for example, diabetes, they have a stroke, they're going to have a worse outcome. They have head trauma, worse outcome.
As you bring up these comorbidities, important we highlight here, we've been talking about it from isolated different variables, the M2 going to M1, but you could stack on, and you're sharing here, diabetes and head trauma. It becomes a lot more complicated when we start bringing in multiple variables in a negative way for the person, whether it be inflammation, metabolic dysfunction, all these different variables that can compound, and it's not as clean as we've been making it out to be.
Well, it's certainly not clean, but with all due respect, I'm going to say that the fact that there are multiple variables is empowering, because it says to that individual, there's a lot you can do. I mean, if you said, look, if you get your blood sugar under control, that's about the best we can do. No, it's not. You're right, there are a lot of inroads to microglial polarization, like lack of restorative sleep, not having enough exercise, not socializing, exposure to PM 2.5 particles in the air that you breathe, wearing a helmet or not when you ride your bike, getting your weight down to where it needs to be. There are a multitude of things, and unique sets of supplements that target the mitochondria within the microglial cells. It helps keep them in M1. But you are correct. There are many, and some would say, oh, that's just confusing and daunting. I look at it as having greater opportunity.
Yeah, no, I agree with that part. It's just the fact that it is more complex than looking at one variable at a time.
Definitely complex, but we're going to eat this one bite at a time. And if I could get an individual to say, hey, it's really a lot and I'm overwhelmed, my response is, let's do one thing today. Let's see what we can do to get you to get a little bit more exercise. You're not getting any right now. How about you walk? Oh, I can't walk very far. Okay. How about you walk to the mailbox at the end of your driveway and back twice a day? Oh, I can do that. Great. We have started. We've started the program. I am so encouraged when that patient says, yeah, I can do that. Because next time we can layer the next step on. Okay, we're going to get you an Apple Watch or an Oura Ring or a Fitbit, whatever it may be. And we're going to start to see how well you're sleeping and how long you're sleeping and what is the quality of your sleep. Oh, I don't know about that. Let's just try it. And let me send me a screenshot of your phone after a week, and let's take a look at what's going on and let's see then what we can do to improve that. Well, I guess I could probably do that. Maybe I'll just do it once or twice a week. Fine. And then we'll get sleep to, 8.5 hours a night with good deep sleep for activating that glymphatic system and all the things. The patient's not waking up as often. We've taken care of some things. We've worked on sleep hygiene, making the room colder and darker, and caffeine curfew at 2 p.m., no more coffee after 2, getting off the computer a little bit earlier, getting some exercise during the day, all the things we need to do to get you to sleep better. That's targeting your brain. We're going to layer that on to the fact that you're now walking to the mailbox twice a day. Next time around, let's start thinking about, your blood sugar is 130. We can do better than that. And, doing all the things that help us bring that blood sugar under control. And it might mean medication. It's a big toolbox. We do what we got to do. And we got to get these things reined in. And I totally understand that, throwing the book at somebody right off the bat is compelling and daunting. But every journey does begin with the first step.
What would you say to the person tuning in right now, feeling overwhelmed? They have metabolic dysfunction, inflammation running rampant throughout the body. What step would be easiest and give them the biggest win to start generating momentum
Here's
get the M1s back to M2?
The most important message from me in all the things that we have talked about, you're wondering, what is it? Is it food? Is it exercise? Is it sleep? Is it socialization? What's the number one thing? And here's the number one message. The number one thing that you can do to set yourself up for brain health is to embrace the idea that you are the architect of your brain's destiny. That's job one. When you get that, then we layer on all the tools thereafter. That's the biggest stumbling block. Why? Because people have been messaged with the idea that we can just do whatever the heck we want, eat whatever we want, stay in that easy chair all day, watch TV, and then when we have a problem, there'll be a magic drug that's going to fix it. That's not reality. So the most important thing is to embrace the idea that you're guiding this ship.
Okay, what's step 2?
Step 2 is to find out what's going to be that easiest first step for that particular individual. And that's sometimes not very easy to discern. But I think, generally, I think it's reasonable to look at diet and make some subtle changes and recognize that, what people want to eat isn't what they should eat. So we have to educate people away from responding to their desire to making knowledgeable food choices. I think food is hugely important. The other things are important as well, but I think food is really, it's the medicine here. Food is the medicine. Hippocrates is often quoted, let food be thy medicine. The reality is these days we've learned that he may not have actually said that, but it's so important because 60% of calories in American adults' diet is coming from ultra-processed foods. And that's a big issue. It's a very big issue. A study came out in January of 2025 in the Journal of Prevention of Alzheimer's. Think about that. The Journal of Prevention of Alzheimer's. What a world. But having said that, this is a study followed 1,375 people for an average of 12 years. The average age, I think, was 65. And these individuals were queried as to their consumption of ultra-processed foods. And we can define that later, perhaps. And it was found that for every single one serving per day of ultra-processed foods, risk of becoming demented was increased by 13%. For individuals consuming 10 or more servings, and that's not unusual, of ultra-processed foods per day, risk was increased about 2.7-fold, almost 3-fold increased risk for a disease for which there is no pharmaceutical fix. So those are sobering numbers, A, and B, it makes it very clear that diet is really related, and C, this becomes a powerful tool for me in terms of my outreach to make people really understand, or let them understand, that food choices matter a whole heck of a lot as it relates to the brain.
You mentioned defining ultra-processed foods. Let's do that, because there are healthy foods that are found in packages. And for people who are especially early on in the eating healthy journey, they may be confused.
So ultra-processed means the amount of modification. So how would you know that a food has been modified? Well, you mentioned packaging, but packaging isn't necessarily the tip-off. Look at the ingredient list. If there are more than 3 ingredients, most likely that food has been ultra-processed. It's been treated in such a way that it has added flavoring, added sweetener, which is more than 60% of foods in the grocery store have added sweetener. Emulsifiers, things to extend shelf life, things that make the food look more palatable, just a variety of ways that the foods can be modified. I understand that one of the so-called benefits of ultra-processing food is extension of shelf life. That's, I think, also related to profitability. But to be fair, what we're going for here are foods that have not been processed. The idea of food manufacturing, to me, is an oxymoron. Food isn't manufactured. Those two words should never be used together. So the trick is to shop the periphery of the grocery store, get foods that are not packaged. You can buy a bag of apples. Technically, that's packaged, but foods that don't require an ingredients list at all are foods that we should be consuming. We don't need ingredients if we're choosing to eat animal protein in our chicken or fish or beef, whatever it may be. Eggs, for example, no ingredients list necessary. You can go online and learn about how much protein an egg contains and how much choline it contains, why that's good for the brain, why fish is good for the brain. You can look up how much DHA salmon contains, really important. But when you see emulsifiers, flavor enhancers, sweeteners, color, etc., those are the foods that we've just got to turn our backs on. But yet, as mentioned, this is 60% of the average American daily consumption in terms of calories coming from this kind of food that is directly related to increased risk of Alzheimer's disease. I have that study at drperlmutter.com, the actual study from the American Journal of Prevention of Alzheimer's from January of 2025. People can read that or read the blog I wrote about it. This is so fundamentally important as it relates to prevention of the very disease for which there is no treatment.
Okay, so step one, ultra-processed foods, they're gone. For a lot of people, that will be a big step.
Yep.
If this is the beginning of the journey for them and is going to have a big impact on their health. What other foods or food categories do we want to be on the lookout for and make sure we're avoiding when it comes to the brain?
I will tell you, and we'll talk about other foods, but I will tell you that if we can reduce or even conceivably eliminate ultra-processed foods, we've done we will win the food battle. That's the heaviest lift, and I call it the low-hanging fruit. But I think the other thing to consider is that we want to be mindful of the types of oils that we consume. We want to consume natural, generally non-vegetable-based oils that have not been processed or modified to extend their shelf life. We open the door to things like extra virgin olive oil, part of the Mediterranean diet, avocado oil, certainly fish oil as consumed as a food or as a supplement. We get fish oil, of course, from eating food like fish, salmon especially. But I think processed oils, and even that said, being careful as to how we cook with those oils, that we're not overheating those oils past their smoke point and then damaging them. We don't want to consume those oils. We build the brain, which is 70% dry weight made of fat. Your brain is mostly fat. Excuse me. We build our brains based upon the fat that we consume. It doesn't come out of the air, and we're not constructing fat in our bodies. It's the fat we eat. And when you embrace that, you realize that, okay, I want to give my brain good fat so that I can build a better brain. The other food classification that I would say needs to be looked at are the processed meats. Processed meats generally help to raise uric acid, and uric acid being elevated is a threat to our metabolism. So you want to avoid processed meat, dried beef, bacon, sausage, those kinds of things, because they contain components oftentimes that are not good for us anyway, but they do also tend to raise uric acid. It's what I wrote about in the book Drop Acid, how important that is. And when uric acid levels are elevated, that sets the stage for diabetes and metabolic dysfunction. And, we've covered that. We know where that road leads.
While we're on uric acid, we know the processed meats, they're a no-no. What other things do we want to be aware of that are going to elevate that?
Alcohol. Who knew? I mean, one of the biggest issues that is related to elevated uric acid is particularly alcohol, and particularly beer. Beer is high in something called purines because of the yeast that goes into making beer. Yeast, when it's broken down, liberates purines, which are really the breakdown products of the DNA and the RNA that are found within cells. That's what yeast is. It's cellular. So purines tend to increase uric acid quite dramatically. So, these are the big things. I think perhaps, though, the largest issue that elevates uric acid is something called fructose. Fructose is a sugar. Yes, the name comes from fructose, fruit sugar. It's a type of sugar found in fruit, and having a piece of fruit is not a significant source of fructose, but drinking a glass of orange juice or drinking a Coke is. Matter of fact, ounce for ounce, orange juice, apple juice, and Coke have about the same amount of sugar. So fructose is directly metabolized into uric acid in the human body. And as mentioned, 60% of processed foods in America have added sweetener. By and large, that's fructose or a derivative of fructose coming from what we call high fructose corn syrup. It's very sweet, it's very cheap, and it is supported by the USDA in terms of agriculture. So there's a lot of fructose in the world out there for us to consume that will raise our uric acid, tell the body winter is coming, increase our body fat, downregulate our mitochondrial function, and make us more insulin resistant.
Okay, let's come at this now from the other way. We've talked about the microbiome. We want to support that. But somebody trying to put together a diet to support brain health, how do they begin?
Through the lens of the microbiome?
No, I just mentioned we've gone there already in the importance. So that's going to be a piece of this.
Yeah.
But we've talked a lot about now negative foods when it comes to brain health. Let's talk about it from the other aspect now, building that plate to support the brain.
Great. What I wrote about in Brain Defenders were the guidelines for the diet that is going to be best for you as an individual. And, these days there are various names of diets. There's paleo, there's mind diet, there's Mediterranean diet, Green Plus Mediterranean. There are a variety of diets that are out there that have various types of names. Some of them are acronyms, some of them define where the diet came from. And I decided I was going to go a different way and said, here's what I want your diet to do. I want it to keep your blood sugar under control. I want it to supply adequate amounts of fiber to nurture your microbiome. I want it to have a lot of color, in other words, be mostly plant-based, unless you're vegetarian, in which case it is, by definition, all plant-based. And that it is a diet that supplies adequate amounts of protein, I define that in the book, as well as adequate amounts of good oil or good fat. Now, what you choose to do is really up to you, but I think it's do the diet, watch your blood sugars, and make sure it's under control. And call it what you will. I mean, we could call it Jesse's diet if you want. Call it whatever you like. But this, I think, tends to make it easier for people because I think people's heads are spinning when they're trying to specifically conform to a diet. They get the app and they enter in every bit of their food. And I know that's challenging. And the problem with it being challenging is that people don't remain on those specific diets after a relatively short period of time. But if we can broad stroke this, I think that's the key to success.
I was happy to see in the latest book, you gave some love to the keto diet. And I think we should bring that up in this context of brain health because with all the other quote unquote healthy diets, there is this additional layer of producing ketones, which the brain loves. So in your mind, who is that diet right for?
The ketogenic diet?
Yeah, because it has this additional layer on top of a lot of other healthy diets
Well,
where
we
we're going to
talk about
produce
it
ketones.
quite a bit in the book, and I think that the question you just asked is excellent. And medical disclaimer here for your viewers: I'm not your doctor, but I think the ketogenic diet is probably a good thing to be used from time to time in virtually anybody. And as a matter of fact, I recently did a podcast with a medical doctor, MD, type 1 diabetic, who dramatically reduced his dependence on insulin based on going on a ketogenic diet. Now that is an example. I think most endocrinologists dealing with type 1 diabetes would absolutely steer their patients away from a ketogenic diet because, as we all know, diabetic ketoacidosis is a horrible, life-threatening event that happens in diabetic patients. But that said, that's a different experience in comparison to volitionally engaging a diet that is more ketogenic when you're a diabetic. Let me just finish this thought on the type 1 diabetics. If any of our viewers right now are type 1 diabetic and thinking about a ketogenic diet, the cautionary note is that if you ever would consider that, it needs to be in conjunction with an endocrinologist, and an endocrinologist who has done this and has experience in this prior to. So that's the caveat. I think that's really very important. Otherwise, there's really very few issues that relate to risk from the ketogenic diet. I don't think that's the plan that's workable for most people all of the time. It isn't for me. And, it's very clear that that's a diet that's difficult to stay on for any length of time. So, to cycle on and off the ketogenic diet for a week or two, probably around 2 weeks, it takes 3 or 4 days to get into ketosis, is reasonable. And to do that every 2 to 3 months is reasonable as well. So that allows your body to become much more flexible from a metabolic perspective in terms of being able to utilize ketones for fuel. It takes some time to become what's called keto adapted. In other words, being able to use these ketone bodies that your body is now producing for metabolic fuel. But we go through this, as you mentioned in the book, and describe the research that has used quite successfully a ketogenic diet in the actual interventional treatment of both Parkinson's and Alzheimer's disease with good results.
How do you think about taking that another step down? There's a lot of talk in our world going carnivore. Can you see value in that for certain people?
I like to answer these types of questions through the lens of evolution, i.e., what have humans been eating for thousands of years? And that shapes our genome. In other words, it shapes our physiology so we can be as best adapted so that we can survive. Yeah, we've eaten meat for a long, long time. Our bodies seem as if they are set up for the ability to consume meat based upon our dentition, based upon the length of our intestine, and based upon what we are able to derive from meat in terms of the nutrients, the protein, and B12. Having said that, iron as well. But having said that, the notion as a hunter-gatherer that we just went around killing mastodons and buffalo and we ate meat all the time, I think is unlikely. I think, we as historically ate a lot of vegetables, a lot of things that we would find growing, and that would make up an important part of our diets. So I think we are omnivorous. I'm certainly not alone in that. And therefore, I think we should cater to our genome. We should give our genome the signals based upon the foods that we eat that it has always received. This is the paleo kind of movement that tries to emulate the diet of our Paleolithic ancestors in terms of being hunter-gatherers. Yes, some meat, and yes, certainly a lot of dietary fiber. In comparison to the amount of dietary fiber that our Paleolithic ancestors consumed, we're consuming, maybe about 10 to 20% of what we had consumed. How do we know that? Well, we can certainly infer what our Paleolithic ancestors consumed by looking at fossilized poop. Sorry, but that's called fecaliths that give us a sense as to how much fiber and really what was the makeup of the microbiome of our Paleolithic ancestors. So I think that being a full-on any type of vor exclusively is not a good plan. I think being a carnivore sets an individual up for lack of dietary fiber by definition. Dietary fiber only comes from vegetables, from plants, and therefore vegetables and fruits. Therefore, that's going to be an important loss for these individuals who think they're going to, be completely healthy by having only animal products. So that's a big issue that I think we need to pay attention to. The other thing that plants are a variety of things, but I think that the polyphenols that plants contain are really important for our health. The polyphenols are what is found in colorful fruits and vegetables. Yes, there are actual polyphenols in animals, and yes, in the third kingdom, which are the mushrooms, there are polyphenols as well. But the abundance and variety of polyphenols that we get from eating a plant-forward diet, not a plant-based diet, what I said was plant-forward, meaning emphasizing plants, really offers us up a powerful key to health, nurturing our gut bacteria, and then those polyphenols having really wonderful salubrious aspects in our general body as well, in terms of antioxidant function, anti-inflammatory function, and even helping us with detoxification. So I think the short answer to your question is, I'm not a huge fan of a full-on carnivore diet.
All right, let's bring fasting in and connect it to the microglia and brain health.
The reason that I talk about fasting in the book, and again, anyone engaged in fasting, this is a practice that should be cleared with a knowledgeable healthcare provider. How do you do it? How does that relate to the fact that you're taking various medications? Certainly, people with diabetes on insulin, need to consult somebody if they're going to be fasting. So, by and large, fasting isn't something a type 1 diabetic should engage in my opinion, that, as opposed to considering a ketogenic diet where calories are still coming in. But the idea of fasting is, I think, good for us at multiple levels, helps us reset insulin sensitivity, i.e. gain control, reining in our blood sugar that tends to creep with age, sets us up for something I think that's very important, and that is the sense of gratitude. I think one of the biggest things that happens to me when I fast is, I know there's all these metabolic things going on that my blood sugars are even tighter control. I'm sure my insulin level's going down. You don't know your A1C because that's a long-term change. But we're helping enhance mitochondrial function throughout the body and in the brain, and therefore we're having a direct effect on our microglial cells. But the biggest issue for me is it really brings me to a place of gratitude. I mean, when you finally get to eat again, you say, there are plenty of people in this world who are fasting not because they've chosen to, and I have food whenever I want it. I mean, and so that's what fasting does to a lot of people. They connect with a sense of gratitude, and I think that's really, to me, one of the biggest goals, biggest gains that you get when you deprive yourself of something that you take for granted.
Walk me through a day in the life of Dr. Perlmutter. What you're eating, when you're eating for your microglia.
So I generally do not eat until at least noon and sometimes thereafter. And typically, though I will have coffee in the morning, I will have, and does that mean I've already broken my fast? That's a matter of debate, but I don't see any real changes in blood sugar or anything like that from a cup of coffee. But that said, I don't eat until 12 or 1. That's after I've been to the gym. I am pretty well convinced that my workouts would be better if I had eaten prior to, if I'd had some protein, some eggs, or who knows what prior to going to the gym. I probably would have a better workout. But what I want to do is compress my eating window between 12 and let's say 7 p.m. such that then I have from 8 p.m. at the latest, when I finish eating, generally it's much earlier than that, until noon or 1 the next day. That's basically fasting each day, or more commonly called time-restricted eating. I've restricted eating to a time-restricted window between 12 or 1 p.m. and then finishing at 7 to 7:30 p.m. as well. What do I break my fast with? Strangely, I don't have a big break fast. And that is, it can be a can of sustainably harvested tuna. Today, it was actually mixed with one of my favorite foods, which is coleslaw. Whatever, don't ask me why, I don't know where it came from. Or I can mix it with pistachio nuts, olive oil, and sometimes some vegetable-based mayonnaise. The only reason I do that is because a lot of times the animal-based mayonnaise tends to be sweetened with extra sugar. So that's what I have. And it's very strange because when I have breakfast, I'm not really that hungry, but I do it because I know that by afternoon time, I'm going to be hungry and get a little, as I say, light in the loafers. And that doesn't serve me well when I'm on your podcast or whatever, academic work I have to do. I have to have my head engaged and brain engaged. And that's why it's good to have some food on board. That's going to take my supplements, which are many. But the never fail supplements are high levels of fish oil, creatine, monohydrate, iron, which is a particular thing for me, a B complex vitamin that is methylated. Again, that's specific for me. Coenzyme Q10, vitamin K2, urolithin A, and a product called Cardigenics and a product called Vasconox that are, again, I think somewhat unique for me. And vitamin D, multivitamin, multimineral, and that's, and berberine. So that's my supplement list. The big players that do not miss are the fish oil and the creatine. I also take a product called Himalayan tartary buckwheat. We talked just a moment ago about polyphenols. That is by far and away the most polyphenol-rich food, I think, on the planet. So I'm a huge fan. There's actually a study that came out now 2 years ago that looked at these epigenetic clocks that we talked about earlier, measuring biological age. And this was an interventional trial in which the intervention group used that product and showed a dramatic slowing of their rate of biological aging by around 40%. And so I'm a big believer in that. What do I drink in the course of the day? I drink a lot of water. I do drink some bubbly soda that is unsweetened, has a little bit of flavoring in it. I might have a second cup of coffee midday, but not after 2 p.m. Though I will have, sometimes at dinner, a little bit of dark chocolate. That's caffeine, right? We have to recognize that. I do have that sometimes at dinner. Not often, but every once in a while I want to do that. And I want to say that I'm not perfect. And I think back last week, my wife and I went out to dinner and I ordered this pasta dish and I enjoyed every bit of it. It was wonderful. So yeah, and that's not an ideal food for controlling blood sugar, but that just was great. And I'm here to say I enjoyed every bit of it. So, I think it's important for people to understand you do the best you can, but every once in a while, why have this inner conflict? I could have chosen the right thing, and maybe I did. Maybe that was the right thing because it was a great moment. Alcohol for us at this point in life is minimal to none. My messaging outgoing was 2 glasses of wine is okay for a man per day, 1 glass of wine or drink for a woman per day is okay. But I think the newer data makes it very clear that call it what you will, alcohol is a neurotoxin, so you don't really want to do it. Is there a place for that glass of red wine from time to time in a social setting? Of course there is. But there is alcohol-free wine and beer out there if you so desire. So finished dinner around 7 o'clock at night, 7:30. And then I use a water pick every night. In addition to brushing my teeth, I use the water pick. That is the signal to me that I'm not going to eat anymore. I never violate. Once I've water picked my teeth, that's it. That seals the deal. Now, getting back to what the morning looks like. So I'm usually up by 6:45 or 7 p.m., a.m. rather, and but no later than about 7:15. And then I get up and either if it's resistance training, weight training, or machine training, that's a trip to the gym, which is fortunately very nearby. That's 3 days a week. And then the other days, almost without fail, except if I'm traveling, would be some form of aerobics, which would be running or elliptical machine, or more recently, a stationary bike called an Averon, which is just for me the cat's meow because it's gamified. Everything I do on that bike is a game, and I'm playing against other people. And that, I want to do well. don't always win, but and just so you're watching the other people's performance and your performance, and the next thing you know, 30, 45 minutes have gone by, and you're drenched in sweat, and went, God, I really enjoyed that. As opposed to either, I listened to a podcast on the bike or the elliptical. That's less engaging for me, and I'm still watching the clock. But when it's gamified, I want to pay strict attention. So, and let me just say one other thing to answer the lifestyle question, and that is, people talk about, well, what's most important? Is it aerobics? Is it strength training? And I say neither of the above and all the above, meaning that it's neither the above. It's not just those two, neither one of the above. It's three. I think flexibility is really important, and you could add to that balance training as well. I actually did that this morning. Flexibility, really important, because once you injure yourself because you didn't stretch ahead of time, then you don't exercise and you're going to sit around and probably eat the wrong foods. We all know what that looks like. And balance training, there are various techniques that you can engage. I think there's a yoga pose where I think it's called eagle, where you're on one leg, the other leg's wrapped behind, and your hands are this way. And try doing that and then closing your eyes. That'll challenge your proprioceptive part of your nervous system. I think that's really very important. But I also, and again, I think that these are important adjuncts to the idea of both aerobics and strength training. A recent study came out that really tried to tease apart, well, which one is it? And the answer is it's both. It turns out that people who do both strength training, resistance training, along with something aerobic, turns out to be the best thing we can be doing for our brains. And is that working through the microglia? I think so.
I was going to ask about that. Different forms of exercise, making the direct connection to the transformation of M1 to M2. Do we have any data there?
As far as the intervention, the exercise intervention, the type of those
connecting
M1
it to brain health
there's
and
no
the
specific data
microglia.
on that yet. I think that what we're going to see is this TSPO imaging of the activated microglia being used to determine what is the effect of a dietary intervention on the amount of M1 microglia that we have, or exercise intervention, or a drug intervention for that matter. So I think as a research tool, we're going to see that much more widely applied, and that's really going to help us understand where we're getting the best bang for the buck.
You went over an extensive array of supplements there. You take them at lunch, correct?
I do. Well,
Okay.
Lunch or breakfast, you call it, because
When you break
I
your
don't eat
fast.
between whatever you call that meal. It's lunch by virtue of the fact that it's that time of day, but it's breakfast because that's when I break fast. There are a couple of other things that I do take that are microglia specific, and that's dihydromyricetin and something called rosmarinic acid. Dihydromyricetin and rosmarinic acid. Those have been actually studied in terms of laboratory evaluation, what they can do to keep microglia in M2. So, these are some really novel, kind of neat new things that are coming down the supplement pike, especially urolithin A. You're quite familiar with that, I'm sure.
Yeah.
What an interesting supplement. That we would have gotten some urolithin A in our bodies by virtue of eating certain foods like strawberries or pomegranate, and then converting a precursor using our gut bacteria into active the urolithins, including urolithin A. It's an interesting story, isn't it? That this was always there for us. Now we can get it in much higher concentration in a pill form and not have to rely on our gut bacteria.
I'm curious on your creatine dosage. Lately in our world, there's been a lot of talk of higher dosage related to the brain. What are you taking? How much?
Let me comment on the brain study first of all. So the study was an interventional trial in early Alzheimer's patients, and their dosage was actually 10 grams twice a day with really interesting results. The most interesting, from my perspective, was not what they saw in terms of cognitive function, but was the increased amount of creatine in the brains. Having said that, my dosage is between 5 and 10 grams a day, tending more towards a higher dosage. I find that I'd like to split that up between morning and evening, however, when I go to 5 grams twice a day.
The other one I was curious about is fish oil. What type, what dosage?
So I take around 2.5 grams of fish oil a day. That's from the product that I take. It's actually 2,400 milligrams. That's a tablespoon of liquid. And I take one that's very high in DHA. It's called DR formulated, doctor formulated, made by a company called Garden of Life. There are other good brands out there as well. That's one that I take. Important that you keep fish oil refrigerated. That's key. That's key. And also, I think to be more personalized about it, anyone who has any sense that their microbiome is dysfunctional is well served by taking a high quality probiotic.
I noticed in the new book you wrote a whole chapter on hyperbaric oxygen. Let's bring that in and talk about who that's for and how it benefits the brain.
The benefits of hyperbarics, I think, need to be looked at first through the idea that the major thing that shifts our microglia away from M2 to M1 is a metabolic shift. In other words, the mitochondria that use oxygen to make energy are taken offline when it shifts to being destructive in favor of another energy production pathway called glycolysis. So mitochondria require a really nice delivery source of oxygen. So, just from that perspective, one would think that maybe hyperbaric oxygen would be beneficial. But it turns out that this technique whereby an individual goes into a chamber that is then pressurized, and that individual then breathes oxygen at a higher concentration in comparison to what we normally breathe. We normally breathe oxygen at 21%. In other words, the fraction of oxygen that we inspire is 21%. Most of what we're actually breathing is nitrogen. So we increase that fraction of inspired oxygen, up to 30, 40, 50%. Some hyperbaric chambers actually use 100% oxygen. So the patient is breathing pure O2, which can be, at prolonged exposure, toxic. But the exciting new developments in hyperbaric oxygen that I talk about that really represents the work of a Dr. Shai Efrati from Israel and Dr. Amir Hadani, also Israeli but trained at Harvard, finds that the true benefit of hyperbarics is the increased blood supply to the brain. And who's not going to want that? So it does so by the changing of the oxygenation that is induced when we are either brought up in pressure and percentage oxygen, or even when we are brought down. That the delta, the change in blood oxygenation, does good things. And we could talk about how you might be able to benefit from that, even with hypoxia. People are now exercising in a hypoxic way by using a face mask. But anyway, when we change our blood oxygenation, it turns on a pathway, turning on something called hypoxia-inducible factor 1 alpha. That's not on the quiz. But what that does is it increases the growth of new blood vessels and increases the caliber of the blood vessels that we have. So it turns on something called VEGF, vascular endothelial growth factor, that stimulates our bodies to grow new blood vessels, yes, in the brain as well, and also enhances the production of nitric oxide that allows blood vessels not only to expand, but also enhances and improves how insulin works within the body. That's another aspect of nitric oxide that doesn't seem to get as much press, but wow, that's important, right? So this is what hyperbarics can do. And when you look at the work of Dr. Efrati and Dr. Shai Efrati and Dr. Hadani, I mentioned their names earlier, they've published research looking at one issue that really relates to polarization of the microglia, which is long COVID. Long COVID is something that is induced by a COVID experience, but doesn't, it gets better somewhat, but there are lingering issues with cognition, with fatigue, with heart function, et cetera. And their results are really quite astounding in terms of the utilization of hyperbarics in long COVID patients. And I think, the real reasons are they reestablish mitochondrial health, i.e. they target microglia, and they're improving blood supply. And they've published their results, and really quite outstanding in a scenario in which people don't necessarily have a lot of options in the world these days. And it's been estimated that as many as 20% of patients or individuals who have experienced COVID have lingering symptoms. So great to know that a program targeting mitochondria and microglia and blood supply can offer them some benefit.
Extrapolating out from long COVID, who would you say HBOT is something they should consider? Is it more prevention, somebody that's already had, say, head trauma?
Yeah,
Who is it for?
I think as opposed to who would I say, let me tell you what the literature supports. The literature, the scientific literature, shows significant effectiveness post-trauma and post-stroke. These are the two groups that have been studied for decades that have demonstrated significant improvement. As a matter of fact, Dr. Shaya Frati published a study, it may have been 25 years ago, which was very influential for me as I was building my hyperbaric center. So, that research has been around an awful long time. But that said, what those two researchers are looking at now and publishing is what they're seeing in individuals with cognitive decline, being able to slow that rate of cognitive decline. In the face of not having a pharmaceutical that can do that, I think that is really quite meaningful. Now, obviously, that's not something everybody can do. But the reason I talked about it in the book is it further, it's a tool that's available, but it further emphasizes how when we target our body's metabolism, in this case with hyperbarics, but in general, when we target metabolism, we're targeting the brain. And that's the home run. Those are the tools that I think are really so important for people to first realize are out there, and then, of course, begin to implement.
Earlier in the conversation, you mentioned weight loss drugs. I want to make sure we come back to this. And it ties into targeting metabolism. The GLP-1 agonist fits under our thesis of the inflammation, metabolic dysfunction into the latter. Let's bring those in and how you feel about them.
Let me explain how I concluded that section in the book. I don't know the exact language, but I said, if you're asking me if I am supportive of the research and the ultimate possible utilization of these GLP agonist drugs as it relates to brain disease, the answer is yes, I am. And again, my mission in writing Brain Defenders wasn't to go all in on eat these foods, get some exercise, and there you go. I wanted to look at everything. I even have a whole section in the book that you'll recall that's dedicated to what the future holds in terms of technology, in terms of medical research. But the GLP-1 agonist drugs fall between those two because they clearly target metabolism. And, to be clear, they were developed for a metabolic issue, which is diabetes. That's where they first were utilized and approved by the FDA as treatment for diabetics. It was then observed that many of these patients were losing significant amounts of weight, and ultimately they received FDA approval for weight management as well. But the microglia have GLP-1 receptors on them. Can you imagine that GLP-1 can have an effect on microglia? There's not been the study yet that has shown that the microglia will go back to M2 polarization through polarization when they are GLP-1 stimulated. But what we do know is that stimulating GLP-1 is a powerful way of enhancing their mitochondrial function. Why is that important? You will recall that it is the decline of mitochondrial function that characterizes the shift from the brain-defending M2 to the brain-destroying M1. So targeting the mitochondria with a GLP-1 agonist drug is very interesting indeed, isn't it? It's not just directly through targeting that receptor, the GLP-1 receptor, but the drugs lower blood sugar, they improve insulin functionality, and they reduce inflammation. And all of those things will quite likely have an effect in the brain. So why don't we design an interventional trial where we use a GLP-1 agonist drug in the treatment of, let's say, Parkinson's disease, for example. That study was published in April of 2024 in the New England Journal of Medicine. 153 patients for 1 year either received placebo or they received a GLP-1 agonist drugs. These are patients with Parkinson's disease. And what did they find? The patients who received placebo continued downhill, continued to decline, requiring more and more medication, becoming more rigid, worsening of tremor, worsening of their ability to engage activities of daily living, all rated on the Unified Parkinson's Disease Rating Scale, a standard way of assessing functionality in Parkinson's patients. But half the group got a GLP-1 agonist drug called lexasenatide. Not Ozempic, so let's be clear, I'm not saying Ozempic yet, but this group that received this GLP-1 agonist drug didn't decline at all. As a matter of fact, had a very minuscule improvement. We have never, ever seen a drug do that. We've never seen any intervention do that. This is breathtaking. That finally there's an interest in treating the fire, not just the smoke. The drugs used for treating Parkinson's have always treated symptoms, the rigidity and the tremor. And there's great value in those drugs because they allow Parkinson's patients to improve in their functionality. But in the background, the disease continues to worsen with time, which means more and more medications and side effects from those medications worsen over time. So for the very first time, using a GLP-1 agonist drug, home run in my book. So there's been a lot of discussion about the use of these drugs in Alzheimer's. One study demonstrated a significant reduced risk in comparison to diabetics not using the drug in diabetics using semaglutide or Ozempic over time. So a reduced risk of developing Alzheimer's over time in diabetics using semaglutide versus those who used other medications. Having said that, a recent interventional trial using oral semaglutide in various dosages did not demonstrate any improvement or stabilization in cognitive decline in existing Alzheimer's patients. As a treatment for Alzheimer's, the study demonstrated that the oral dosage of semaglutide was ineffective. But what it did show was a significant reduction of the C-reactive protein, a marker of inflammation. Ultimately, that's got to be good, especially in light of the microglial cells. The question is, is that enough? So we will see. It may be that semaglutide, being a larger molecule, is not able to make its way across the blood-brain barrier into the brain, but at least peripherally it worked. So I think it's great that these drugs are being explored. I think the idea of Ozempic for one and all is not something I would be supportive of as it relates to necessarily weight loss, because I think it is a commitment for lifelong usage of the drug. But Alzheimer's is almost uniformly a fatal disease. So I would look upon the use of a GLP-1 agonist drug lifelong in an Alzheimer's patient, managing the side effects, if it worked and if it proven effective, I would certainly look upon that as something that I could get behind.
One of the things I fear about these drugs is the fact that they're going to likely deter a lot of people from making the lifestyle changes we've been talking about today and use it as a shortcut. And like you said, for life, and not actually getting to the root of the challenge.
I think anybody who is going to adopt a GLP-1 agonist drug in their regimen needs to recognize that for whatever reason you think you're using it, it's going to have to be, at least as things are today, a lifelong commitment. Because most people regain all their weight when they stop the drug, If you're diabetic and stop the drug, unless you're going to use some other type of pharmaceutical intervention, your blood sugar is going to go up. But I would say if you're an Alzheimer's patient, making a commitment for the rest of your life, you're going to take this drug, something to think about, provided, like you say, we look at side effects and manage those side effects, or we stop the drug if the side effects are unmanageable and are compromising quality of life.
One of the things I think we need to make sure people understand is that diabetes, type 2 specifically, is largely, if not totally, reversible. The way I understand it, modern medicine tells people that's a chronic condition they're going to live with once they have it. Again, this ties into the drugs and the shortcut. People need to know that there is a way to walk out of this naturally so they can at least make an educated decision whether or not they want to do lifestyle or drug.
That's right. And I think, thanks to the work of Dr. Sarah Hallberg, there's been, a real exciting development in the type 2 diabetes world that it's not necessarily an issue that you're going to have to live with. I mean, it's pretty well assumed that, yeah, you've got your diabetes now. You've started on the medication. You're going to see the endocrinologist, maybe get some dietary counseling. But, you're pretty well assuming that with time, they're going to be bumping up my metformin or whatever drug is being used because it's going to get worse with time. And it's just so unfair to message people with that mentality because it's disempowering, disenfranchising. And I think that what you mentioned is so valuable and so very important that, for example, ketogenic diet has been demonstrated to reverse and, in fact, end diabetes in people who are followed carefully and engage that. I am not saying that, go on a ketogenic diet and throw out your medication. Believe me, I want people to understand this is something that is done in conjunction with a well-trained health practitioner. So what you say is very true. That's a reversible condition. Type 2 diabetes is a reversible condition.
Let's talk about mental health now and the connection between this M1, M2 and how that fits in.
First, I would say that we have gained an understanding that many of our mood disorders like anxiety and certainly major depressive disorder have a powerful inflammatory component. And as such, we assume, therefore, that this is going to shift those microglial cells from M2 to M1. This is relatively new. I mean, there are now, books written that look, one is called Brain Energy, that looks at the energetics of what's going on in the brain, in the neurons and in the microglia from an energetic perspective, really focusing on the idea that when we shift away from mitochondrial function, we're setting the stage for increased brain inflammation and polarization away from being helpful of our microglial cells. So it's a very, very good question, very good point. Why so? Because it takes us out of the realm of being solely dependent upon drugs to realizing that lifestyle interventions may play a role here. Now, we've known for years that there can be some significant benefits of lifestyle intervention in patients, for example, with chronic depression, with respect to dietary changes and exercise and paying attention to sleep, for example. What are the mechanisms? Well, inflammation, improved insulin sensitivity, increased production of new brain cells, which seems to be something very important in the treatment of depression. So we move away then from this idea of lack of serotonin is the cause of depression to these other issues that, researchers and clinicians like Dr. Uma Naidu at Harvard and Christopher Palmer, the author of the book that I just mentioned, have made so clear to us. And I will refer back to an earlier part of our discussion where we talked about the imaging of the activated microglial cells, that TSPO imaging, that is seen to be lit up, i.e. microglial cells have shifted from M2 to being destructive M1, as demonstrated by how these TSPO images light up in major depression, telling us what? this is a shift in the immune function in the brain. And what do we know? We know that that can be brought on by the metabolic changes that we've been talking about.
And this ties back to another earlier part of the chat when we talked about different neurodegenerative conditions, Parkinson's, Alzheimer's. I asked you about, now that we have this information, how you look at maybe there being a common thread there. Now we can bring mental health challenges in. Do you look at them under the same umbrella?
Absolutely. In fact, I unpack, as you know, I unpack that quite a bit in the book. Brain Defenders is not just about Alzheimer's. It's about mood disorders. It's about autism spectrum disorder. And it's about Parkinson's, and really, a global approach to brain health. And I think it's so important that we drive home the point that depression is a brain-related disease, that mood disorders, psychiatric issues are related to the brain. Why am I emphasizing this? It's because I had an interview the other day with a Dr. Daniel Amen, and he does SPECT imaging of individuals with brain trauma, Alzheimer's, and mood disorders like depression as well. And he said something very interesting. He said, psychiatrists are the only discipline or specialty that doesn't study the very organ that's involved in their specialty, the brain. They don't image the brain. They don't, and that's what he has done for 30 years, SPECT scanning of the brain to determine what areas are involved. And now he's able to predict, by looking at a brain SPECT scan, who will respond to what particular medication might be used. So I think it's very important to understand that these are brain-related disorders, though they may be significantly influenced by issues outside of the brain, like in the gut. There's a lot of work being done now relating and emphasizing the relationship between dysbiosis, the changes in the gut bacteria, and risk for depression, for example, through the mechanism of inflammation.
We know a key part of our thesis today is mitochondrial health. Any other major players we should bring into the conversation to help bump those up and facilitate healthy mitochondria?
I think we've got to dedicate ourselves to our mitochondrial health. I mean, every organ in the body is so dependent on energy. The heart muscle, the detoxification processes of the liver, everything depends on having enough energy to carry out its tasks. So, well beyond the brain. And I think first, let's remove the threats. What threatens mitochondrial function? Inflammation and insulin resistance threaten mitochondrial function. We've been talking about this at length today. And how do we, are there ways of nurturing mitochondria? Well, exercise is certainly one. It helps us grow new mitochondria and helps us engage in a process whereby our bodies are able to rid themselves of defective mitochondria, a process called mitophagy, a form of autophagy. Maybe people have heard of autophagy, but not mitophagy. So we want to engage mitophagy, get rid of the bad players, and engage also mitochondrial biogenesis, the growth of new healthy mitochondria, youthful mitochondria. As a sidestep, there's even research now looking at the idea of mitochondrial transplantation. Can you imagine taking mitochondria, let's say, out of the muscle, of a healthy muscle tissue, spinning it down and then administering it into an area where it is needed, like the brain? But supporting mitochondrial function with good nutrition is extremely valuable. Again, keeping blood sugar under control. Supportive mitochondrial supplements include things like a coenzyme Q10, a good B complex vitamin, acetyl L-carnitine, and certainly creatine monohydrate or hydrochloride, and I think DHA as well. These things are all supportive of mitochondrial health and should, no matter what you're trying to avoid, as it relates to any chronic degenerative condition, it all starts with the mitochondria. So you got to do everything you can to keep them on your side, keep them healthy. And again, healthy mitochondria keeps our microglial cells in their brain defending role.
Last question for today. We've covered a lot. People may be feeling overwhelmed in a good way, but let's give people a short checklist. Top 3 things people want to make sure they're doing after listening to this interview to enhance their brain health and the health of their microglia?
Sure. First thing I mentioned earlier, recognize that you don't need to be at the mercy of a pharmaceutical fix. That brain health begins with your choices every single day. That's the most important message that I can convey. Now, beyond that, I would recommend, this may sound self-serving, but the book is called Brain Defenders. That will give you chapter and verse, everything you need to know to chart out a program to really be the architect of your brain's destiny and not be subject to having being at the mercy or hoping that some magic pill is developed. Beyond that, the sleep recommendations, supplement recommendations, dietary recommendations, exercise, new technologies, even the idea of that 40 hertz flashing light in your eyes, all of these things are fascinating and interesting and things that we can incorporate. But for sure, it's time to take the reins of control and realize, again, that your brain destiny depends on you making the right choices starting today.
Earlier, you mentioned the upcoming tech. What piece of technology or equipment is up and coming when it relates to brain health that you're most excited about?
Well, I don't know that there's one that I'm most excited about, but there's some really exciting things coming from the tech perspective. There is ultrasound treatments of the brain that may in fact be showing promise in terms of improving cognitive function. Who knew? This 40 hertz light and sound therapy that restores gamma oscillation that has been shown to target microglia is very exciting. There are researchers working on ways of administering various types of molecules that can help revert T1 or M1 microglia back to being M2 supportive. Microglial actual transplantation is now taking place in humans. My goodness, even mitochondrial transplantation is taking place in humans. There's something I describe in the book called RNS-60, an experimental treatment that has been shown to have a significant effect on ALS and on stroke patients, reducing the amount of time that they are hospitalized and being associated with improved functionality. And this is a direct mitochondrial targeting agent with no demonstrated side effects whatsoever. We're watching the science as it relates to that product very, very closely. Very, very exciting. So there's a lot to keep an eye on, and you could set up Google to ping you every day when these things are announced. And that's one of the things I look forward to every day is what's next. But it's great that we're seeing the focus move away from this accumulation of beta amyloid as being the cause of Alzheimer's to really a broader perspective, especially one that is really finally highlighting the role of the immune system, these microglial cells that we've been talking about today, and how even today we know how our lifestyle choices are powerfully influential in terms of keeping those mitochondria and microglial cells in their brain defending mode.
Dr. Perlmutter, thank you for this empowering conversation. We're going to link up Brain Defenders, your social media, your website, everything in the show notes. Thank you.
Thank you. Bye-bye for now.
Thank you for watching. Stick around here for this other great interview. You don't want to miss it. I'll see you over there.
What if your healthy diet has been the problem all along? That's what a lot of people are discovering. There's real power in feeding your brain properly and letting it try to heal itself. Nutrition and brain metabolism.